Hi everyone, Scott Nicholson again with the Judy Nicholson Kidney Cancer Foundation, bringing you our next entry into the Patient Support Speaker Series. And today we have a very exciting speaker in Caren Hughes, who is a clinical pharmacist of oncology at the Mayo Clinic in Jacksonville, Florida. And today she's going to talk to us about different medications and treatments and adverse effects to those medications, and also how you may be able to find some financial assistance in paying for those medications. So, of course, if you have any questions, please leave them in the comments below. We'll be happy to get to them during the video today. And without further ado, let me turn the camera around and I'll introduce Caren. Hi, Caren.
Hi, Scott.
Thank you so much for joining us today. I know that our followers really appreciate your input. Could you explain to us a little bit about what a clinical pharmacist does?
I think everyone that is listening to this has worked with pharmacists, and there's many different things a pharmacist can do, just like other areas of the medical profession. A clinical pharmacist, and what I do, gets very deeply involved in care for the patient. We work with medical teams. So the pharmacist is one member working with the medical doctor and with the nurses to provide the very best care for patients. Of course, my area of expertise is medications, and for each of my patients, I spend a lot of time discussing with them about their disease, about the treatment they're on, making sure we've provided all the right things to help with side effects, and working with them and their families for any questions they have.
Wow, so really a lot more than what a typical pharmacist would be tasked with. So could you explain a little bit about some of the adverse effects that patients may have when they're undergoing treatment?
Of course. Now, cancer is unfortunately a very broad topic. I know most of the people listening in are most interested in kidney cancer, renal cell carcinoma. When we look at side effects, over all cancers, the biggest problems that our patients deal with often is the result of the chemotherapy they're taking. People have a lot of nausea, vomiting, constipation, diarrhea. Now, I'm just mentioning a lot of side effects. Most people do not have all of those. Those are the key ones we deal with. When you look at the subset of our patients that do have kidney cancer, thank goodness many of the drugs we have now are oral drugs, but they come with a whole different set of side effects. Things like hypertension, or people that do have high blood pressure might find that to be aggravated. Side effects that deal with the skin, something called hand-foot syndrome, and a number of other specific adverse effects.
Thank you. And what recommendations do you have for medications to address those adverse effects?
It's going to be very individualized, but what we start with in the field of cancer, like most professions, we have guidelines. Now let's talk about, for example, nausea. It's abbreviated, the National Comprehensive Cancer has a bunch of guidelines that tell us for specific drugs, if someone's going to receive that drug, this is what you should do to prevent nausea and vomiting. And then there's other steps. If they still have nausea and vomiting and we've not been able to make their life very comfortable, then there's other drugs we can use. So there's very specific guidelines, and we have a lot of options in our bag of tricks, because no one should accept that nausea and vomiting is something they have to deal with.
Before we got started on the video, you had talked about a calendar for treatment and how many drugs are taken on a certain schedule. Could you elaborate on that?
Sure, it's a good topic, Scott. Thank you for bringing that back up. We find that in the medical profession and in the companies that make these pharmaceutical drugs, it seems easy to us if you're on a drug for 2 weeks and then you're off for a week. Or in the case of sunitinib, for example, if you're on a drug for 4 weeks and then off for 2 weeks. But for most of us, and myself included, if I was going to be treated, it's very difficult. And we try to do things explaining to the patients why this is important, providing calendars, so you don't have to worry, well, let's see, is this the 3rd week? Is this the 4th week? What should I do? Very clear calendars for our patients. and their support group. So it's very easy to see when they should take the medications and to have us be available by phone if there's any questions.
You had mentioned a medication list. Is there certain medications that people can expect to go on if they're diagnosed with cancer? What are those medications?
Well, yes. When I talk about a medication list, almost everyone, if they write down all the drugs they're taking, whether they're a cancer patient or not, it's probably a pretty long list. And all of your medical team wants to be very aware of everything you're on, including things you buy that were over the counter, that were not prescription drugs, for a few reasons. We want to make sure that whatever issues you're having, you're on the very best drugs and most cost-effective drugs for you to help control that. We want to make sure that you're not on a number of drugs that might work against each other, because that would be counterproductive. That wouldn't really provide the best care for you. We want to make sure that you're not on a drug you don't need to be on. And we also look at the list to make sure that all the issues you have, that there aren't any drugs that are missing. So when the medical team, and usually it's the pharmacist that will do that, looks at your medication list, please help us by being sure it's complete, even if it's a multivitamin, even if it's something you take that is not a prescription that you bought at Walmart or Walgreens. It's important for us to know, because sometimes those drugs do interact with the drugs you're taking also, or medications that you might be on. There are, for most cancer, like most diseases, your nurse or your doctor or your pharmacist could say you'll probably be on these medications, and it's going to be unique to everyone. So we want to make sure that fits well with the drug list that you're on. Most places where you receive care should ask you for that drug list. So if they don't, tell them you'd like them to do this. You'd like the pharmacist to look at your medication list, and then they can include updates for new medications. Every time you can come back, they can help you with that. If you don't have a drug list, and that's difficult to do, I'm really not sure how they dream up some of these names. They're very difficult to pronounce or difficult to remember. Your pharmacist can also help with that. They can help you build the drug list, and every time you go back, whether it's a pharmacy or a clinic or the hospital, the pharmacist should make sure that it is an up-to-date list. And if you go, for example, unfortunately, if you go from the clinic and you're admitted in the hospital, pharmacists on both sides should make sure that list moves with you and is correct, and help you to update it every step of the way.
Thank you. Is there any special information on how these drugs should be stored? Is there a proper way to store them?
For most of the drugs, now of course there's drugs given through the vein, and there's oral drugs, depending on the specific individual patient, what your doctor decides, and the stage of the disease. For most of the drugs that we use in renal cell carcinoma, there's not specific storage requirements, but it's always something you should ask. Across all of cancer, some drugs need to be refrigerated, some drugs expire after a month, so it's a very important question to ask, and hopefully your pharmacist will cover that with you depending on the specific treatment.
How and when do you obtain refills for that medication?
Yeah, that's a question that used to be a very easy one to answer. If we remember back, a number of years, no matter what the drug was you got, you would go to your pharmacy. Whether the doctor felt it was appropriate or not, you would have refills, and every month you would call your pharmacy and say, I'm going to pick up my next month of refills. That's gotten to be much more difficult for two reasons, because these drugs are very expensive, many of them, and many of them have specific, sometimes serious side effects. So the amount of control that both the government and the pharmaceutical companies and the doctors are putting on this are different. So what does that mean? Many of the drugs that you may be on, and this is not only for renal cell carcinoma, but for other cancers as well, may only be available from what we call specialty pharmacies. And what is a specialty pharmacy? Some hospitals, for some drugs, can get a designation as a specialty pharmacy. So if you go to Mayo Clinic, Mayo Clinic pharmacy may be able to get your drug, but it's not as easy as going to Walgreens or CVS or Walmart. You may be told this is the pharmacy where you need to get your drug. Some of the drugs are actually shipped to your home. So it's very different than it used to be. Usually, for the most part, drugs still are refilled monthly. If your medical team does not cover that when you receive your first prescription, feel very free to ask them. It's their responsibility that for the specific drug you're on, you know if it's going to be received through the mail. You'll know if someone's going to call first to see if you're at home. You'll know if it's just something you can pick up at your Walgreens or if it's something you can only get from a specialty pharmacy. But do ask them that if they don't cover it, because you have enough to deal with. You don't want to be worrying about how to receive your drugs.
How can pharmacists help with understanding a person's disease in terms of the medical terms and grading and things like that?
One thing that I've become very sensitive to is that I am not in your shoes. And what I think makes a lot of sense, because it's what I studied for my degree, is very confusing. And some of the things I studied are even very confusing to me. Plus, a lot of you in the audience are patients or are caregivers, and I don't have to explain to you that there is so much going on, so much you need to deal with. And for a lot of you, this is out of your field of study. You know, you may be skydivers, you may be rocket scientists, but perhaps you haven't studied deeply the disease or studied the drugs, and it's a lot of new stuff being thrown at you. And I will admit, even though we try to be very sensitive to that, when you're receiving information from your medical team, sometimes it makes sense to us, but may not make sense to anybody else. So, in my role, one of the things I do is once a treatment has been decided on, or a patient has received information about drugs they're going to receive, I sit down with the patient and their family and their caregiver and whoever else they'd like to be involved, and I talk about that. I talk about what side effects they may see, any questions they may have about their disease, and I try to make time be no issue so that I can understand what your questions and your concerns are, give you written material that hopefully you can refer to when you go home a few days later, when maybe the fog clears a little bit and you're able to understand, numbers for people you can call when you have questions later on. So really to sit down and get inside your head and see what it is that you want to know, not have us telling you things, but what questions do you have that will make things easier and more understandable?
How can pharmacists provide information and moral support to family members and caregivers?
I found that when you're sitting in a room with a family or with a patient and their support group, patients, of course, are very interested. Sometimes they're not the person in the room that asks the most questions. Sometimes they don't have the biggest concerns or the biggest levels of unknowns, and they may know a lot about their disease. So it's very, very important that whatever member of the medical team that you're face-to-face with, you should feel entirely comfortable to ask for the pharmacist, to ask the physician for more information, to ask if there's somebody else you can speak to, because you are in charge, right? We're there to support you and to provide the best level of care possible, to help you through this, and not only to help you with your disease, but to help you feel good about what treatment you're going to be receiving, and to make you feel like every question you have can be answered. So I play a key role in doing that, and in your subsequent visits, you should feel entirely comfortable asking away until every question has been addressed.
Thank you. We have a couple of questions from the Facebook group. Someone's asking, do you recommend that patients investigate clinical trials?
The short answer is yes. Everyone should be aware that clinical trials are very carefully designed. Any of you out there that have been on trials know this. There's a whole list of age and other diseases patients may have. So there's a number of things that have to be checked off to see whether or not a patient is eligible. If somebody has a stage of a certain disease, whether it be cancer or a non-cancer, it's very appropriate that if we know what a treatment is that will address the disease, then a clinical trial may not be appropriate. But however, if you do fit the description for a clinical trial, you absolutely should pursue that.
Are there any medications or drugs that may be soon to be legal that you may be excited about, or are there any medications that are soon to be available to the masses that they should look out for?
The reason that I'm not prepared to address that is that there are an unbelievable, absolutely unbelievable number of drugs in the pipeline. And the pipeline is how we describe all those drugs that are in. It takes 10 to 20 years to get a drug approved, and it starts, of course, with non-human trials, and it goes to phase 1, phase 2, phase 3. Many patients and many members of the pharmaceutical community and the medical community get very frustrated because it takes so long for a drug that is to go from an idea to something that's available. I get frustrated as well, but it's done because we want to make sure these are new drugs, and many of what we use for cancer we call poisons because they do kill cells. We need to be absolutely careful that we're aware of the side effects and that it is something appropriate to be approved for our patients. That being said, I'm sure you've heard a lot in the news and in the ads about immunotherapy. You know, through the years, if you look at the history of cancer treatment, there's a lot of different major groups of cancer treatments that we have discovered. Immunotherapy helps your immune system fight the cancer, and we have already seen some drugs approved. I'm sure you've all seen the ads for Opdivo, nivolumab, or pembrolizumab, and I think we'll see a lot more drugs in that class, immunotherapies. They're very well tolerated. They do have side effects, but they're well-tolerated drugs. A lot of them are oral drugs, so they're easier for a patient to take. So I think, you know, we need to keep our eyes wide open across all cancers in renal cell. I think we'll see a lot more in those categories come out.
Would you mind elaborating on immunotherapy medications and what makes them different from other types of medications? I'm not sure what the classification of immunotherapy means.
That's a great question. So let's compare. Now, there's a number of classes of drugs, but let's compare what I call classical chemotherapy. And those of you that have done a lot of research on just general cancer, you'll know that, you know, mid-late 1900s, there were drugs discovered that killed rapidly dividing cells. Now, the reason that's important is that, think about, cancer cells are rapidly dividing cells. That's a problem with a cancer cell. They get in the way of other things. They're multiplying like crazy, and we can't stop them. Most of your adult cells, they're like sitting on the beach, they're having a margarita, they either don't replicate or they only do when it's important. So if you have a drug that looks for something in a cell, because cells are different when they're replicating, looks for those things in a cell and targets them and kills them, you get more cancer cells. However, there are healthy cells, there's not a lot of them, but there are healthy cells that do divide quickly. Those are your blood cells, and those are a lot of the cells from your mouth all the way down the GI tract, gastrointestinal tract. So some of you are thinking, oh, that's related to side effects. Yes, it is. So classical chemotherapy is very effective in killing cancers. However, there's a pretty significant side effect profile. That's why we see a lot of nausea, a lot of vomiting, a lot of blood cell counts that we have to watch very carefully. So there's always been a hunt within the scientific community to find drugs that do as well or better targeting cancer cells, but don't cause as bad side effects. So there's a whole class of chemo that I'll skip over called targeted therapy, where we look for other things that cancer cells display, like maybe a protein on the surface, that most healthy cells do not. So the drug can target that thing that a cancer cell sees.
Okay.
So to immunotherapy. Immunotherapy, there are a number of drugs. They work different ways. The drug that I mentioned, Opdivo or nivolumab, is the scientific name, actually removes a break. So there is brake on your cells that stops the immune therapy from revving up. Because if it did, you would die from immune-sensitive diseases. There are some of those that are non-cancer diseases. So the normal state for a healthy body is you don't want that immune system going crazy, because then you can have other problems. So there's what we call a brake, keeping the cells that are our immune regulatory cells from working too much. So if you have a drug that goes in there and removes the brake, your cells in the immune system, we call them your T cells, they are not stopped from working, and they can duplicate and they can go after the cancer cells. Now, we have to be careful with new drugs. We have to be careful with clinical trials. Many of the drugs that we use now do not cure cancer. Many of them do not prove to be useful in everybody, but they do provide benefit in a lot of people, and for many of them can prolong healthy survival for an appreciable amount of time. So that's what just the immune drugs I'm talking about, the specific one I mentioned, that's the way that it works.
Thank you for expounding on that. Do you recommend, there's another question from our Facebook chat, do you recommend that patients investigate vocal trial opportunities? I'm actually not sure what that is.
I'm not quite sure what you mean, vocal trial opportunities.
It could, I'm wondering if maybe it was a typo, because I'm not...
Well, whoever asked that question is probably listening. Let me talk for about 30 seconds about the availability of clinical trials, and if they, was that fair, if they want to...
Oh, I know what it was. They had, okay, I see what it was now. It was the same person who had asked about investigating clinical trials. I think it was a typo. But we have another question, though. Does Mayo Clinic engage in kidney cancer clinical trials?
Yes, Mayo Clinic does. I happen to know this because I had this question for somebody who is not a patient outside Mayo Clinic. There's a number of ways you can connect with Mayo Clinic or any of the big cancer institutions, and that is you just go to the web and look for Mayo Clinic information. The home page will pop up. It will have numbers you can call, and people can guide you to the correct practitioner. They can tell you if there are specific clinical trials. Yes, Mayo Clinic does participate in clinical trials across all disease states. Whether or not a very specific clinical trial for a very specific disease, whether you can access that through Mayo Clinic, depends on the individual and depends on the trial. If you are a patient and that's something you're interested in, I would encourage you immediately, first thing tomorrow, to find that homepage for Mayo Clinic, and there are numbers you can call there to contact folks to ask about clinical trials.
Thank you. You had mentioned that in some cases, there's assistance in finding programs that help some patients pay for their medication. Could you elaborate on that?
Yeah, there's a number of ways to access that. I mentioned earlier talking about pharmacies that you get your drugs from, that some of these drugs are very expensive. I don't think it surprises anyone out there. The cost of healthcare is extremely expensive. What insurance covers for many people is covering less and less, so it's a huge concern. People are not only dealing with this devastating diagnosis and trying to get their arms around their treatment options, but then they're also dealing with insurance companies and the huge cost of these drugs. Here's another piece of advice on what you can ask. Many pharmaceutical companies for these expensive drugs do provide patient assistance. Some of that depends on the amount of what the patient makes. Some of it does not. So for any drug that if you and your physician decide on a certain treatment route, and you understand the cost of that, you can talk to your insurance company, and many clinics can do this for you. A pharmacist or a mid-level like a PA can make those calls with your insurance company and check on coverage. Sometimes the actual pharmacy where you get it filled can do that. If this information is not volunteered and you find that your insurance company does not cover the drug or doesn't cover enough of the drug, or it has a large copay, and a copay, if your insurance company covers the cost of a prescription, there's usually some money you have to pay, even for a normal prescription like $25. But it varies. If the copay is too much, ask the question, is there an assistance program? And that might be the pharmaceutical company itself that sells the drug may provide help. It may be for just a few months. It may be for a lot longer than that. There are also foundations that provide assistance. So if it is, if you would like to look at assistance, press your medical team, press the pharmacist, press your pharmacy, and I hope you wouldn't have to go this far, but you can always go online. Let's make up a drug. Let's say you're getting Zuma. Usually if you go to just the web and you Google Zuma.com, usually it comes up with the pharmaceutical company's website for that drug, and usually there's a link that says patient assistance.
Okay, awesome. And then what about things they can do outside of medications? Is there, can you provide any information to support a healthy lifestyle? Any information on weight management, exercise, appropriate nutrition?
And again, this is general information. What you need, talk to your medical team, whether it be the pharmacist, a mid-level, a nurse, the physician. Remember that cancer is one thing you have, but it's not your entire being. Although at times it does feel like it's totally encompassing us. It's still important to eat well. Specific foods you eat are going to depend on your lifestyle. It's going to depend on other diseases you have. You know, if you have diabetes, that may more specifically mandate what your diet is. If you have, if you're under treatment for some issue with lipids, with your heart, make sure that gets incorporated onto whomever your health care provider is. But it's still so important that you sleep well, that you eat well, and that you drink a lot of non-alcoholic, non-caffeinated, non-sugared beverages. That's always important. So the specific things to help you with a healthy lifestyle are only going to be a little different as to what you would tell someone else, because that will make you feel better. People ask me about exercise all the time. There are many studies for many diseases that show that exercise is helpful. Because remember, regardless of your outcome, how you feel between now and then is extremely important, and you have a lot that can change that. Any exercise you decide to undertake, always run it through your healthcare provider. You don't want to start skydiving if you're on some side effect. For
Maybe
example,
start with yoga.
Maybe start with yoga. But always run it through your healthcare provider to make sure there isn't something specific about you where they think you should go slow. But I would really, really encourage people to walk, things like yoga, swimming, whatever it is you love, you should continue doing that with the blessing of your physician.
And I think one of our last questions, how can pharmacists help with counseling on details about your drug therapy, possible adverse effects, and what you can do?
Remember that all the healthcare providers, if they don't, they should understand, as I said, that you're in charge, and we are there to help you feel well mentally and physically through this journey. Pharmacists specifically can help you with whatever you need. If there are so many things coming your way, you would like us to write down or type up what a daily routine would look like. If you would like us to provide a calendar, just tell us what your needs are. If there's things you're leaving the clinic with that you're uncomfortable with and that you really don't understand, you really should ask that question of somebody. And if the nurse is not available, if the physician has gone on to other patients, if you're fortunate enough to have a clinical pharmacist there, ask if you can have some of their time, and the answer will always be yes. Now again, my background and my training and my work history has not been in the community pharmacy, but they are very, very valuable professionals. They should also, if you don't have access to somebody else, they should be able to provide information, give you printed handouts, or even advise who else you can speak to. So remember, you're the boss, and you should easily be able to find somebody to help answer whatever questions you have.
Thank you so much for doing this today, Caren. I know that a lot of our viewers got something out of it, and if they have any questions, they can leave them in the comments below, and would you be able to get back to those?
I'd be very pleased to answer any questions you have.
Awesome. Well, thank you again, Caren, and let me switch this camera back around. Thank you, everybody, for tuning in today. If you have any questions, leave them in the bottom below, and Caren and I will be happy to get those answered for you. What kind of things are you interested in us bringing to the Patient Support Speaker Series in the future? We want to know, so leave that in the comments below, because we're always wanting to bring in different speakers from different backgrounds dealing with oncology and cancer. So thank you again. Until next time, we'll see you soon.